Stress is the inflammation that robs us of life, energy, and happiness. Our typical solutions for gut health and hormone balance have let a lot of us down. We're over-medicated and underserved. At The Less Stressed Life, we're a community of health-savvy women exploring solutions outside of our traditional Western medicine toolbox and training to raise the bar and change our stories. Each week, our hope is that you leave our sessions inspired to learn, grow, and share these stories to raise the bar in your life and home. All right, so today on The Less Stressed Life, I have a return guest for a totally new topic. But the last time Dr. Emily Gutierrez was on the podcast, she really wowed us talking about autism and pandas. So if you didn't hear those episodes, and if you're a clinician, or if pandas is essentially, in brief, when a child gets strep and then all of a sudden is not themselves anymore very long later. So if that strikes you, make sure you go back and listen to that, because she did such a beautiful job just being so generous with information. So Dr. Emily is the Chief Scientific Medical Liaison and Formulator for Neuro Nutrients and has over a decade of clinical experience managing patients in her busy practice with Neuronutrition Associates, one of the first pediatric-focused functional medicine practices opened in the U.S. She received her doctorate from Johns Hopkins University with a focus on translational medicine as a doctor of nursing practice. She received her master's degree from the University of Texas at Austin and is board certified as a pediatric nurse practitioner. She's also board certified through the Institute of Functional Medicine, a board certified as a clinical nutritionist, and board certified as a primary care mental health specialist. When she has time, she's an active researcher, writer, and speaker, and her passion for formulating science-based nutrient compounds that meet strict standards of quality and efficacy continues to be her favorite tool in managing patients, which I feel like that was born pandemic time, wasn't it? Is that when you kind of started?
Absolutely.
Like, I need something for this brain. I need something to do. So I'm going to just create a supplement line. I have some very close friends that have supplement lines. And so we meet usually once a month, and they're always highlighting the challenges. And I'm like, you guys don't make me want to have a supplement line at all. So anyway, I appreciate what you guys do. And obviously it's a Wild West. And so if you can care about integrity and quality, that's good. And it's always nice if you can develop the supplement you wanted for your clients when no one makes it. So I'm sure that was needed. But today, for fun, Dr. Emily is going to get we're talking about something a little different, still very medical, but still such a needed topic. Today, we're talking about breast implant illness. And I will say that not very long ago, right before you reached out to me to talk about this topic, I had a client say, she's like, I'm a little embarrassed to talk about this, but I'm thinking about having my implants taken out because it's just not really, it doesn't really, the same kind of story. It's like, I really felt like I needed these at one point and I don't really feel like I need them anymore. And I'm concerned about some of the side effects. So we're going to talk about what that can look like, because it's just one of those many topics that needs a little more publicity so people know what their options are and what some of the pros and cons are, because it probably feels a little bit like a lonely path if you feel like you're dealing with breast implant illness. So thanks for coming on today to talk about this.
Absolutely. And thank you for having me. I've been asked a couple of times to talk about my personal experience. And I feel like we've had great conversations. I really like your style and your flow. And I trust that you and I can get this message out together in a really clear and meaningful way. So I'm a little nervous. I'm getting vulnerable and personal, which I don't typically speak publicly on my own health or things that are going on with me personally. But I feel really passionate about this because I want women to have informed consent. And I think that I wasn't given informed consent, and many women that are trying to make this decision on what to do don't really have informed consent. And what that means to me is that you have all the information to make the decision between the pros and the cons on what you want to do for yourself. So we can have this conversation.
Yeah, that was actually going to be one of my questions later, because we're going to talk about breast implant illness, and these implants have an expiration date. And I was just kind of curious if that was brought up at the beginning. But let's start at the beginning, right? Let's start at the beginning.
Okay.
Let's start about what happened for you postpartum that led you to breast implants, and then what happened after you had them.
Well, I don't regret for 1 second having my child. William is 20 now. One of the best accomplishments of my life for sure. But it was also the hardest thing in my life I ever did was have a baby because I had severe postpartum depression. In fact, I had postpartum psychosis for part of it. And there's just this radical change. You're supposed to have this baby and there's supposed to be rainbows and butterflies and flowers and your life is supposed to be amazing and meaningful because now you extended your family. And it was everything but that for me. I had severe anxiety, severe depression. I was afraid to be around my baby for a long time. And part of me getting well was learning how to really take care of myself. And I learned that exercise was amazing for your brain during that time. So I went from having gained 3 times the amount of weight you're supposed to when you're pregnant to now having this kind of like body that I didn't recognize. And I had this crisis of like, who am I? What do I look like? Who am I as a mother? Who am I as like a woman? And my breasts were not what they were pre having a baby.
The old tube sock phenomenon.
Yeah, you got it.
This is also a huge topic, right? Before we even get into breast stuff, like we often talk about the fourth we call it the fourth trimester I think that's what we kind of call it. It's like the postpartum woman is not really cared for, right? And actually I know we're going to get into breast implants. So I want to ask you now, so it's more on topic. Do you have thoughts about your postpartum depression in retrospect? Because at that point, I'm guessing you were very different career-wise. You were a very different place in your life 20 years ago. So what do you think about it?
Oh, yeah. I was extremely estrogen dominant. I think that's probably one of the biggest features of my depression. And I didn't really understand much about methylation or glucuronidation or estrogen pathways. I didn't really understand that not keeping my weight low when I was pregnant and like what that would mean for me afterwards, especially with my estrogen dominance. So I think it was a huge shift of having so much estrogen to then it bottoming out and just the rebalance of thyroid and estrogen and all of the things. And I had very, very poor support. So I didn't know about vitamins like I know about vitamins now. I just didn't have what it really took. And really honestly, I think everyone should encapsulate their placenta, even though that might sound a little strange. But if you encapsulate your placenta, which means basically you dry out your placenta, you put it into capsules, and then you take it over time, and you take more, and then a little less and a little less until it's done, then you all have this crazy shift from so much hormone to no hormone. People with PMS can know when your estrogen gets high before it falls, when you menstruate, if you get irritable and anxious around that time, you're more vulnerable for postpartum depression for sure. And I kind of had a traumatic birth with my son. There was a time where I thought, am I going to live through this delivery or is he or we both going to die? And so they also know when you have really a traumatic birth that you're more likely to have postpartum depression. And then he just came out, he had tracheal malaise. He didn't have a good suck swallow. He had a big injury on his head because they had to suck him out, get the suction to get him out. He was very irritable. He had reflux so terribly that he had, all the milk coming out of his nose and mouth at the same time. Just very, very unhappy infant.
What mom would be anxious about all of this?
It was hard. It was super, super hard. During this period, I'm just trying to regather myself and figure out who I am. And I really just had a crisis of like, who am I in this space going forward? And at that time, breast implants seemed like a really good idea. So I got them.
Yeah. And what happened?
And I loved them. And I was happy to have them. And I knew they had an expiration date. But, when you're in that space, you're like, 10 years it's a long way away. I'll just deal with that then, So fast forward, I'm living in Austin. I know a lot more about medicine, functional medicine, nutrition, really changed my lifestyle, really changed who I was. The breast implants were becoming disingenuous to who I felt like I was as a person. And then I heard the musing. Some people can get sick from these. Is having a foreign body in your body really that great for your immune system? So by the time the expiration was up, I went to a surgeon here in Austin. And I said, I've been hearing that people can get sick from their breast implants. I really just want to get them out. And at that time, he looked at me and he said, Emily, you're too young. And if we take them out, you're going to look deformed. We should just replace them. And then you can deal with it in another 10 years. So I went against my gut and I'm like, okay, I'll just replace them. That's what I'll do. So I went under the knife again. And within 6 months, I was having heart palpitations. I was having premature ventricular contractions and atrial contractions that were premature as well. And I didn't have any association that was with my breast implants. I just thought, oh, I'm just too stressed. I have too much on my plate. I'm drinking too much caffeine. Like there's all these reasons that maybe it's happening. I mean, but it worried me so much. I went and wore a Holter monitor, went to the cardiologist,
Right.
had an evaluation from it.
If you had anxiety history, then heart palpitations does not go over well in your brain.
Oh, no.
Yeah.
No. And I don't know about you, but in this space of being very focused on other people's health,
Oh, yeah.
when it's your own health, things can feel amplified. So when you feel your heart going out of rhythm, that can also create anxiety, which is just perpetuates the problem of rhythm disturbance, right? So I kind of put it to bed, had a beta blocker to take it if I needed to, and then just ignored it. And then things started to come up a little bit, like I'm a little fatigued. I'm having a little brain fog. Oh, and then I started to get this chronic rash between my breasts. And I'm like,
it's usually the last straw for people, right? Before that, you were like, I'm just overworked and tired and getting old.
Yeah, just overworked, tired, getting old.
But this rash between my breasts, this is abnormal for like, they don't say I'm going to get that when I get older and stressed, right?
Exactly.
That's the straw.
Exactly. And it just was this perpetual rash. It looked like not even eczema, but like these little pustules that would come up and like little zits almost, little acne between. So I was having these things that were vague and I'm like, well, I don't really know if I have breast implant illness, but I keep hearing about it and I really want these out.
Because you were how many years into the second implants at this point? When this was coming to a head, when the rash happened, how far into the second implants were you?
About 2 years.
About 2 years.
About 2 years into it.
Yeah.
So I got my first set when I was 26. And then 6 years ago, I got them replaced. And a year after that, I started having heart issues. And then a couple of years after that, I started having this chronic rash that would never go away.
And all,
everything, topical steroids. I tried some ozonated ointment. Everything I would do, it would temporarily abate and then it would come back. It would just come right back. As soon as I'd quit putting something on me, it would come right back.
Because it was internal, not external, right?
Yeah.
It is that funny you brought up, I went against my gut. Man, I mean, I really have to. And sometimes it's really good. These things where we go against our gut and we have essentially a trauma, because this is a trauma for you, right? Obviously. But we all have these things, like maybe we make an investment somewhere, it doesn't work. I'm just speaking from a personal experience. Maybe you make an investment, it doesn't work out. And then around that thing, if you don't really address that, right? If you don't address like what went wrong there, I went against my gut feeling. If you don't really process through that, you start to kind of like live out. I don't know if I'm saying this eloquently, but it actually kind of taints everything else in your life a little bit if you don't sort of address those comments. So I can hear you say like, I went against my gut and I listened to this other guy for what was best for my body instead of myself.
Right. And I didn't want to look deformed. Like deformed, I was like, well, gosh, I'm going to look deformed. This is really bad.
Yeah, I should thanks for that word.
Yeah, that was exactly what he told me.
Yeah.
So we talked about the different options at that time, like fat transfer and other things that you could do that were non-implant. And like, that didn't work. Nobody had the good aesthetic from that. Really, the only thing that you can do is replace them. And I don't think he was interested really in helping me do anything else. So when I came to the decision, it's time to really just move forward and get these things out of my body.
On your heart 4 years after it, I was like feeling.
Oh, yeah.
I mean, you were like, I tried all the other things for my skin. Did you think at that time, like, this might be part of it? Or you're like, I just wanted to get rid of these anyway? Both, maybe?
A little bit of both. And then I think that the universe brought me two very important women, and they both were close friends of mine that had explants. And They shared their story with me. Like, I didn't even know the amount of inflammation I was carrying around until I got them out. And one person was extremely proud of her aesthetic about the way that she looked. She just felt really great. The other one had chronic mold issues that finally she got to resolve those and was feeling better and better. I mean, I was hearing the stories of, I got them out, I felt better, I'm better for it. So it was on my heart. And it is that, like, I knew it was convenient for me to replace them rather than to go through the work it was going to take to get them out at that time. But I knew as they became more disingenuous to like my body and just being in this space of like, I want to have good nutrition and I want to put clean things on my body and I want to live as naturally as possible. I was ready for it. Mm-hmm. So I got some recommendations and I saw 3 people before I found my surgeon. The first person does explants and a lot of breast reconstruction for cancer. And she gave me the best price. And she said, Emily, I'll take them out. And I don't think you need to do anything else. You just kind of figure out how you feel about it. And 6 months after that, if you don't like it, we can go in and try to do something with the aesthetic. But this is the key. She said, but I won't take out your capsule unless it looks sick. So what a capsule is, when you get the breast implants in your body, everybody creates a capsule around it. It's your way your immune system is trying to tie it off. And when it comes to breast implant illness, I think it's really important that you take the capsule out no matter what it looks like, because it's the amount of immune reactivity around that foreign body.
Yeah. What's it actually made out of?
My gosh.
Like, can you describe it in some way? Like, how can we visualize? Because we can imagine maybe an implant being kind of a bag of silicone, right? Mm-hmm. But then if there's a capsule around that.
That's a really good question. What is it actually made of? It looks like part of a placenta around your implant. I wish I had the words to describe what is in the capsule, but it's like a vascular immune complex around the actual implant itself.
It's a bit invasive to remove.
Yeah.
It's unless like they take part of your body and help create it. Is that what you're saying?
Yeah. Well, there's a technique called an in-block encapsulectomy, where surgeons have learned how to go in and remove the entire capsule around the implant. And eventually I found my surgeon because he specializes in explant and he specializes in taking out the capsule with the implant. So the second person I went to see was like, oh, we can do a great aesthetic. I can fat transfer. It works really well. You're going to love the way you look, but I won't take out your capsule unless you look sick. And so I have a really good friend that's a functional medicine doctor here in town. And she said, Emily, you have to go see Rob Whitfield. So I'm like, oh my gosh, who is that? She said, well, he's like a functional medicine plastic surgeon. If you can believe it, there's an actual thing. Just go and talk to him about, what he would suggest for you. So when I went to talk to him, like he started talking about glucuronidation and detox and glutathione. And I'm like, oh, wow, we kind of speak the same language. I think this is my guy. Plus, when he takes out the capsule, he sends it and he tests everybody for cancer. So there is a cancer associated with having breast implants. It's called anaplastic large cell lymphoma. And it's usually associated with textured breast implants. I had smooth ones. My risk was less, but he sends it off for that. And he also sends off all of the capsules for testing, PCR testing, to see what was actually in your capsule. So I liked that. I'm like, ooh, more testing to know if there's 1, I have a cancer risk, and 2, what else could have been going on to make my capsule sick? So I chose him and I underwent the explant surgery with him, and he took my breast implants out, and then he also lifted them up and he transferred fat to improve the aesthetic of the surgery. And I'm so glad.
Just curious.
A little bit everywhere. And I'm telling you, that was the most painful thing I've ever gone through. A little bit in your abdomen, a little bit on your flanks. And it is liposuction. It's liposuction. So that's where they get the fat. And Dr. Rob will say fat is the best filler. And I guess it is. The risk with fat transfer is it might die. You might not keep all of it. So I did an extra step after explant that I think was really helpful. I got into my hyperbaric chamber for 40 hours right after surgery. Not 40 hours like I got in, I didn't get out for 40 hours, but every day I would spend a couple hours in the hyperbaric chamber, which is good too, because the more breast surgeries that you have, the more you mess around with your nipples, the more risk of nipple necrosis you have. So they might not actually reattach and have the blood flow. So that was a really important thing that I was happy I had a tool to get into my HBOT and right after
I also
surgery.
like how many hours you told us you used it. And actually, let's do this question. Did you see changes, healing? Like, what do you think you saw from using the HBOT potentially? This is my favorite part. I know you spent 40 hours in there, but how long to see do you think it sped your, I mean, this is the third surgery you've had. It's probably the maybe more
Yes.
intense one. By the way,
Yes.
I spent a moment Googling breast implant
What?
capsules, and now I know what you're talking about because it looks like I have seen these on Instagram and they cover the picture. They're like, this photo is graphic because the implant just looks like what you think it looks like. It looks like a flat ball of liquid, like a silicone, whatever. Most people have maybe seen this, but the capsule is like part of your body. It's like skin and tissue and whatever. And it's like, oh, what is that?
Yes.
That's what it looks like.
Yes.
Essentially.
Yes.
So they must have created it somehow. I don't understand, but they must create it somehow around, right? To try to protect it. It's like use something natural in the body to protect this silicone thing. I have to talk about it.
Oh, yeah. Oh, yeah.
I understand what you're talking about. So anyway, but back to HBOT.
Well, what happens over time with that capsule too, that I think is important to know, is it can start to develop something called capsular contracture, where it hardens. And it hardens so much, it starts to basically squeeze the implant. And that's what were happening to mine. Probably one of the biggest things I didn't tell you, that I was like, my breasts starting to feel like rocks before I got them out. I'm like, why are they're not soft and supple. They're just like hard rocks.
It feels like calcification.
Oh, and it 100% is.
Is that what it is?
In fact, yes. One of them was so calcified that it ruptured my implant and it was leaking silicone when he took it out. So I had a ruptured implant with silicone. In the capsules, when they sent them off for PCR, I had staph in them and I had another bacteria called Cutibacterium acnes in that. And guess what happened 1 week after I got them out?
Tell us.
100% that rash that I'd had for years was gone.
Oh,
100%. With no intervention whatsoever, other than, of course, my major surgery to get them out. But it completely, and the Cutibacterium acnes is probably what the rash was about. So they were covered in bacteria and they were ruptured and they were calcified. Like I had no business having them in my body anymore.
If one has been leaking, I feel like this might happen a lot. I feel like I know someone else who had a ruptured one, which obviously, because I know one person, probably happens a lot. But
the percent is high.
Yeah. So if someone has a implant leaking, that should become obvious at some point in theory, shouldn't it?
Well, it depends on which type of implant you have. So if you have a saline and you have a leak, you can just drain out the saline, right? So you'll have a difference of one breast size to the other. But if you have silicone, they're like gummy bears. It can be open and spilling out, but it still isn't going to really deplete it the way that, say, a saline would.
Well, now you have more questions. So did they talk to you about the difference between silicone and saline? And do they like poo-poo saline? Because saline feels like it could have been more safe.
Doesn't it feel like it could be more safe? Yes, I think that originally it was, well, if they rupture, then you're going to have to go back in and do it. Whereas your silicone implant can have a rupture and you're not going to have the aesthetic be so wildly different.
That's bad, actually.
So yeah.
So I have another question about this, which is, I feel like the big one, this is why people maybe don't do it, because I don't remember who I was talking to about this, but she said, I just don't really want to spend the money on it, so I'm going to do it. Can you talk about the costs associated with explant versus replacement? Or like, can you just ballpark us? Because I'm sure it's like all over the place, but I mean,
Oh, yeah. It is all over the place. And I think it depends on the extras that you get with it, right? So the first surgeon was like, I'm just going to take them out. We'll just make a little slit, take them out. No big deal. She was going to charge me $10,000 for it. The second surgeon that wanted to do a lift and fat transfer, it was twice that. And fortunately, because he's really good at what he does, Dr. Rob was the most expensive for sure.
yeah, did a lot of other stuff, right?
I did. I mean, he used exosomes in the OR, so he put them on the scars afterwards. He did a lot of testing on them. Yeah, he definitely went the extra mile on all of my care. He has a program like before you can see a nutritionist and do all the things, get ready for it, and after. I didn't personally need to do that just based on what I do, but you're probably going to spend around $20,000 if you get a really good explant, and maybe a little bit more.
Well, isn't it like $4,000 to put them in?
Yeah, 4 to 6. I mean, I think 4 is probably on the lower end. It's probably more like 6 to 10.
Right. But I'm thinking, my brain is like thinking earlier 2000s numbers, and I just haven't updated my brain. So 6 to 10. So I can see where this doesn't feel as accessible, right? Like, it's part of the problem is like no one can decide they want to take their implants out and just like go do it. They have to find a partner that they trust to do it, because probably one of the reasons they wanted them out in the first place is because they're having a bit of a mismatch from what the normal surgeon would think, right? Obviously, as you experienced.
And I think it's becoming, as more people are talking about it and talking about their experiences with it, at least people are starting to hold the space for maybe this isn't the best decision for us to improve the aesthetic of our breast as women. I want to save space and honor those that have had breast surgery that need reconstruction because of cancer. I don't think there's a perfect solution for them, because if you're extremely thin, where are you going to get fat for fat transfer? And if you have to have a mastectomy or a lumpectomy, I mean, that's a hard decision to know, how are we going to reconstruct these in a way that you feel like it's good about your body? There's a lot more into it. I think the message that I really want women to hear is, if you're just doing it to improve the way you look and that's your bottom line, you got to think about the risk associated with it. Cost is a huge risk, because the cost today in 10 years is going to be a whole lot more when you're going in under anesthesia, you're finding a surgeon, and there's just a cost to your immune system and your total body inflammation. About 2 weeks after surgery, I haven't had one PVC. I haven't had one heart rhythm disturbance at all. 2 days ago, I went back to see my cardiologist, and he did an EKG, and we talked about my breast implants. And he's like, Emily, it was infection and inflammation. It's amazing. I've heard of a few other of my patients that have had this done, and all of their rhythm disturbances go away. So what was the cost to my heart to have that infection and autoimmune inflammation right next to it? It was stressing my heart out.
Yeah.
That alone, other than that weird rash that I'm so glad is gone completely, I'm not willing to do things that I know are stressing my heart out purposefully. And
Had you done some blood work around inflammatory markers before your explant and saw things looking off?
Yep. My CRP, my C-reactive protein, was starting to go higher and higher. So yes, I did.
You were feeling it a little bit. Okay. So I got us all distracted from the HBOT conversation. So I'm going to take us back over there and talk to us about kind of what your interpretation of how HBOT helped you. But I know you spent 40 hours in it, but let's talk about the earlier stages. When do you think, and this is just your best guess, like what were some of the results you saw earlier? Because what I like to do is, because we're logical humans and we'd like to think about things in proof, it's like, please tell us some proof about like how long it takes to really see a change from HBOT, essentially post-surgical intervention or whatever.
Well, I'm a huge, huge advocate of HBOT. We actually dispense them to patients from a company called Summit to See. I think OxyHealth, you've probably seen those at conferences, the OxyHealth providers. They're about twice as expensive, those chambers. Summit to See is about half, and you can get a pretty good chamber in your home for about $7,000, which sounds like a lot of money, and it is a huge investment. However, you can use it over your lifetime, because HBOT is basically oxygen under pressure. And when you put yourself under pressure and you oxygenate your tissues better, you have more exponential healing. And in the space of autism, brain injury, near drowning, there's so many different things is when you put your body under pressure and put more oxygen into it, you oxygenate the periphery, right? So you're oxygenating your blood, you're oxygenating your fingertips. It helps with cerebral flow of oxygen. And it's so healing for so many things. So, it was not a question to me if we could get into HBOT right after surgery. And Dr. Rob said, it's really interesting, Emily, because there hasn't been a lot of studies using hyperbaric right after surgery. But he's all in. He has an HBOT, his clinic. But the day after I got into it, and I took the pain meds for probably 2 or 3 days. So I didn't want to fall asleep in there and have my husband help me in and out of it and to monitor it. But I was in it immediately. And when did I see an effect? I mean, my brain, I didn't even know I had brain fog. I literally did not know I had it.
Yeah, you previously had it, right?
And about 10 hours into HBOT, I'm like, wow, I am thinking super clearly. Getting into the office, doing all my stuff. It's just I don't know. It's like the haze kind of lifted.
What year was this?
I did this 6 months ago.
Oh, I was going to say, well, look at what you're going to be able to do now. I was like, maybe you did this a couple of years ago, right before you started your company. Whoa, things are going to get real unhinged here because your brain is working at full capacity. Look what she could do at half capacity. Wait to see what she could do at full capacity. Just another little HBOT rabbit hole. So your practice has an HBOT and you work with neuro stuff. What are the indications that you're using HBOT for in your practice, which is a bit of a tangent from our topic today. I love sauna, but I feel like HBOT is the next awesome thing that helps a ton.
Oh, it is. It is the next awesome thing I think that can help 100%. And here's the caveat on sauna. Think about sitting in a sauna and heating up your breast implant.
Oh, yeah.
People with breast implants shouldn't be in the sauna. And I was in the sauna a lot before that.
I never thought about that.
I didn't either until we talked about it with Dr. Rob. And he's like, don't do that, Emily. No.
Yeah.
No.
Well, I mean, duh, but I don't even think it's and also I don't actually have implants. And so sometimes if you don't have an experience, you forget. The reason I can speak to skin issues with such empathy is because I know what people are going through because I've been there. So it's just different. We learn the most through experience, right? And so now I will never forget. Now I'll go put on my intake forms. Do you have breast plants? If so, please ignore any sauna recommendations, right? Yeah. So I don't actually forget to tell someone something important like that, right? Back to HBOT in your practice.
Yes. Well, autism is probably one of the biggest indications for it. We know that 40 is a minimum amount of hours, but 60, you can start to see improvements in development. And I think anybody that has any nitric oxide issues, maybe they have a gene where they're not making nitric oxide, maybe they have a mobility issue, it can really help with almost anything neuro, including seizures, including cerebral palsy, including those with brain injury from trauma. So we know for sure in science that the sooner you get somebody in the hyperbaric chamber after they have a near drowning episode, you can save their brain. You can save them from dying if they go straight into HBOT. We also know that if you go straight into HBOT after a traumatic brain injury or a concussion, that those neurons that are stunned that are going to die, if we feed them more oxygen, you won't have the sequelae and the adverse kind of death of those neurons because you've oxygenated them.
I know someone that just had a stroke and wasn't found for a while. So that would be a good use for someone like
100%. 100%. 100%. We've always had, if you have a trauma level 1 hospital, you're going to have an HBOT in that hospital, and it's going to be, and that's the hard shell chambers where you can go under 1.4 atmospheres of pressure, where your fire risk increases. And there's a little bit more nuance to the safety of it the lower you go. But it's in every hospital because we know it will heal your wounds. So people with decubitus ulcers or bed sores or things, you put them in the hyperbaric and it literally will heal their wounds. I had a friend that accidentally cut off his finger and they sewed it back on and it was necrotic. It wasn't healing. After 3 hours of HBOT, he was getting all of his sensation back in his finger. Pretty remarkable. Mild hyperbaric doesn't have the fire risk. Professional athletes will take them on the road with them as they're going to games. So it's post-workout recovery. You can get into the HBOT. You can do concentrated air. So if you do a concentrated air, basically it takes the air in the room, concentrates it to 94% oxygen. Then you can put it on via nasal cannula and you get more oxygen under pressure, but that doesn't have the fire risk like doing pure oxygen would. So mild is a soft chamber that only goes up to 1.4 atmospheres of pressure. And the prescription for it is 40 to 60 hours for most things, but you can use it off and on throughout your lifetime for a variety of things.
Mm-hmm. I had a aunt that they were going to amputate. She was 100. She died last year, I think. So they were going to amputate her. Like she had a sore and it got infected. So they were going to amputate her leg. I mean, that's a very minimized version of it. They did essentially what they would put in a field in military, right? Oxygen bag, and she had a nurse, she hired a nurse to come in. And so it was actually a study. Her doctor just wanted to amputate her son to university. They were in California. So found someone who would do this study essentially, or like help them with it. And so they did that. But for me, I'm curious about this and we can talk about it more later. I'm just curious about it because it doesn't feel extremely accessible to everyone, but you're very accessibly like there are. And I'm familiar with, there are some things that you can send home with people, but sounds like you're doing the thing. More about a little bit later.
And what I love about, and families too that invest in a chamber, a lot of times once they're done doing those 40 to 60 hours, they'll pass it on and sell it to a friend or give it to a friend. And you can break it down and move it. It's not like the hard chambers. Once you get them down and you have to do all this construction and all this ventilation, soft chambers are a lot different and they are way more accessible. Dr. Hirsch is probably one of the leading physicians that's done a lot of work around HBOT. And they've shown based on scans of the brain pre and post that mild hyperbaric can be just as effective as going lower and needing to go to a place that does hard shell chambers. So it can be really effective and it can be really accessible. And there's lots of chiropractors that have one. There's lots of alternative healthcare providers that have them. Plus,
I already mentally drew a line in this room and was like, how can I build a wall to have that in this space? Just because we don't have that here. Okay, so you went to Dr. Whitfield, you had the explant, he sent out the capsule, found the infections, no intervention, clear the rash. 10 hours later in HBOT, you're like, oh my gosh, my brain works. Did you do any other follow-up with Dr. Whitfield?
Yeah, and he followed me pretty closely. We had 3 or 4 visits after that just to make sure everything looked good, to check in. He's actually doing some studies now looking at EEGs, pre and post explant, quantifying what the actual brain fog looks like via EEG, which I think is really interesting. So I felt extremely supported. And I did my own stuff, HBOT, glutathione, just lots of rest. But really when all my heart rhythm stuff went away, I was like, man, this is wow. This is just wow. I just thought this was going to be me for the rest of my life. So really positive thing, positive experience for me.
So you mentioned one of your friends had mold in her implant. So my point in saying that is that mold can cause almost any symptom. It's really annoying, including brain fog, including rashes, including whatever, including maybe some heart rhythm stuff, honestly, because it kind of ruins absolutely every system. Are there any other breast implant illness symptoms that are really common that you think we should give lip service to if people are trying to figure out? Because I would imagine it's like an immune response, so it can throw off absolutely anything.
And that's a great point, because I think that if you've done the work to balance your gut, you're not eating inflammatory foods, you're taking the right vitamins, you're really working hard on all of these other things, environmental toxicity, glyphosate, you name it, yet you're still having some type of chronic autoimmune activation. That's when I think you really need to just be honest with yourself. If you have implants, like, can this be coming from my implants? Is this because I have foreign bodies in my chest that my immune system is feeling stress from? So it's a little different for everyone. It's vague. And I think the criticism in the industry, well, one, it's a moneymaker to put implants in. Two, it's not fully accepted by all surgeons that breast implants can actually cause harm. But I think it's important to know and to hear people's story that I did this and so many different things improved. And it's heterogeneous what the symptoms are. You're going to hear about chronic rashes. You're going to hear about brain fog. You're going to hear about autoimmune activation, inflammation where you can't find it from or don't understand where the source of it is. But it's a little different for everyone.
I think there's like two camps of women. What do you want to say? And you did a good job like speaking to those that may need to do some reconstruction and that there isn't great options. So anything you want to say to a woman who's considering breast implants in retrospect, and then anything you want to say to a woman who is considering explanting her implants?
Okay, the one that's considering it, you got to be prepared for it may or may not cause another chronic autoimmune activation in your body. That is true. It may or may not increase your risk for cancer. That is true. And also, you're going to have to replace them at some point. And what the cost is today will be different in 10 years. So there's risk to doing that. You're going to have to go under anesthesia again. You're going to have to address it at some point. You just don't get them put in and forget about them for the rest of your life. It is something that you have to manage. So if you're willing to then say, yes, I want to have it done, I also would say, well, lifting them up and putting fat into them, if you have fat in other places in your body to do it, it actually can be a really nice aesthetic. I'm pretty happy with my results. I'm pretty happy with my aesthetic. And I thought I was going to look deformed because that's what I was told. So the fact that I actually like the way I look and I don't feel deformed and my husband's still chasing me around the kitchen, it's awesome. So the aesthetic can be there. It doesn't have to be done with an implant. And I think we're better and better at doing it. And for those that are thinking about getting it out, if you have anything chronic that's health related going on and you haven't been able to really solve it by doing other things, you never know what you're going to benefit or how your body's going to benefit if you get them out. And I really think it's worth the risk of trying. So I feel lighter. My inflammation feels better. I don't regret it at all. And Krista, I haven't had one friend or one colleague or one person I've ever known that's gotten them out that has regretted it. Not one. So I don't know.
How was your husband throughout the journey? Or maybe he had no opinion. Just curious, because sometimes they're kind of opinionated.
Oh, of course. I mean, I've been married almost 25 years and he's like, Emily, I support whatever you need to do. I support whatever you need to do. And I mean, he's just been super supportive, but it's everybody's question like, oh, how'd your husband feel about that? Well, he knows that if I'm not totally at peace with how I'm treating my health, I'm not going to be at peace, period, just because that's who I am. And he's like, I'm going to love you no matter what. And he's pretty darn pleased with the way I look as well. So we won. We won doing this.
Yeah. Yeah. I feel that when I schedule this interview, I should do a follow-up on what happens if you don't wear a bra? Because I'm on this journey of no bras. And like last week I wore a bra and my boobs were so saggy. And I'm like, there. So anyway, I got to pull the information about this. When you don't wear a bra, they naturally perk. I'm just like so curious about this. What an industry we've created around our breasts, right? What an industry.
Absolutely. And, I like Soma has these really amazing bras that have no underwire. They have no straps to them. They're just like sports bras that they're really super soft on your body. I'm totally against underwire. I have been almost my entire life. And it's interesting, right? I don't know, but whatever you wear, it should be comfortable and it should feel, you should just never wear an underwire.
Yeah. One thing I will say here is that you may listen to this episode and maybe it applies to you in some way directly, maybe it indirectly applies to you, But I think there's just different times and phases of our life where we're ready to hear, we're ready for a message, we're ready for a sign. And sometimes it's this sign, sometimes like you couldn't have convinced me to not wear a bra before my friend was diagnosed with breast cancer. I was just kind of like, it was like a last straw for me. I was like, what is this crap? Like, I am done. And the other idea, my team had been like, no bra camp, sharing all this information about it. And I was like, wait a second, I need to see that now. I am now ready for it. So anyway, just using that, like sometimes this might be the right message that the right person needs at just the right time.
I love that. I love that. And this isn't going to help me sell a supplement or do anything for my practice. This really was just my heart wanting to be open and vulnerable because I think it's so important to have informed consent. Once you have informed consent, it's your choice for what you do. But hopefully everybody that listened to this episode has a different idea of how getting them or not getting them could affect the longevity of their wellness.
Well, I do have one. I feel like I may have half-assed this before, but did they not really tell you about the expiration date around implants when you had them put in? Just curious.
This is what they said. Yeah, most times you get them out in 10 years, but there are people that have had them for 30 years with no problem.
Ah, I see. Interesting.
They told me that. 2 different surgeons told me that on 2 different occasions. Like, yeah, you probably won't have to get them out in 10 years. It'll be fine.
Interesting. Okay. I know you said you weren't talking about supplements, but tell us a little bit about neuronutrition.
So Neuronutrition is my functional medicine practice for pediatrics. Neuro Nutrients it's going well. It's going really well. Are you familiar with Immunolin?
Oh, very. Absolutely. I've talked to the reps. I actually just got done talking to a client practitioner about this earlier. So I have a lot of feelings about Immunolin and immunoglobulins and their utility in high doses in autoimmune conditions. Immunoglobulins are my favorite thing in the world. That's the all.
I love to hear that. Well, I've been prescribing Interrogam, which is basically Immunolin. So it's the bovine concentrate and it's only one person, Intera Health makes it in the entire world. I don't know if you know that or not, but I'm making a supplement with Immunolin. And what I'm doing is I'm putting inulin from chicory root and I'm putting sun fiber in it because my one complaint about Interrogam or high dose immunoglobulins is it can cause a little bit of constipation. So this will help keep the bowels nice and moving along. Plus, my one thing about giving somebody too many prebiotic fiber, too much prebiotics, like for autism, there's something called the Nemechek protocol where you'll give super high doses of inulin to increase the beneficial flora, but then you're asked to pulse it with an antibiotic called rifaximin because you create SIBO. You create this overgrowth in the small intestine. So isn't it beautiful if you put the prebiotic fiber with the immunoglobulin with it? So you're going to help increase the beneficial flora with keeping the overgrowth at bay. So I'm really excited that's coming out in a couple of weeks. I've been working on it for 6 months.
Did you test them together?
Oh, yeah. Yes, absolutely. And I've been using them clinically together for a long time. So I think it's going to be good. But is going good. It's going really well. Our mood support is, I can't say this, and the FDA would come knocking on my door, but I'm telling you, I think it works better than SSRIs. I think it works better than Prozac. And I prescribe Prozac. I prescribe SSRIs because sometimes that's what someone can benefit from. Not all times, but our mood support is just, it's working really well. The formulations, now that it's been in the marketplace for a little bit of time, it's really encouraging. I'm excited about it.
What's in it?
So in mood support, you have a very high dose of a methylated B. I also put a high dose of folinic acid, which is really important for methylation, especially for people that have any antibodies or absorption issues into their brain around folate. So I don't know if you know about the folate receptor antibodies, but sometimes based on autoimmunity and especially in development of children, you can create antibodies that are either binding or blocking getting into the cerebral spinal fluid. The workaround is folinic acid. And we've shown that maternal antibodies to these folates can be present preconception and after birth. And we've also shown that these antibodies can be one of the causative factors of autism. So in order to bypass it, it's not methylfolate, it's folinic acid.
My friend who has a prenatal talks about this all the time.
Oh,
But
folinic acid, it's like the forgotten form of
Yeah.
folate.
well, it's confusing.
Not folic. Yeah, well, it's not folic acid. So let's
Right.
be really clear. It's not
Right.
folic, it's folinic. So yeah, it has folinic. It has a very high dose of the methylated B. It's 5-hydroxytryptophan, which is a precursor of serotonin. And then it has crocus sativus in it. So saffron extract, which is a natural SSRI.
This is the second time I've heard of saffron extract in the last 2 weeks. And before that, it was never on my radar at all. So I may have looked at the product label and glossed over it because I didn't even think about it. So I saw it recently in a PMS support, I think, or something like that. So
It's known for mood more than anything. It's also been shown to improve attention. It's also been shown to decrease leaky brain or help with blood-brain permeability. It's very well tolerated. And not just in the combination and synergy with the other ingredients. And I put a touch of zinc in it because a lot of people with attention and mood disorders are low in zinc. It's been really, really good. I feel really grateful for how well that product has been working. So thank you for asking about neuronutrients.
Speaking of, I bet there's not many sources for getting saffron extract either.
But your friends that own the supplement companies, I had to work really hard on finding the right type of extract from the right manufacturer. And it is the most expensive ingredient in the blend for sure.
Yeah.
But it's effective. It's effective. And what's interesting about it is, if I were going to prescribe Prozac, nobody really sees an effect after 3 to 4 weeks, right? You got to be on it about 3 to 4 weeks. It's just really the same thing with Midsport. You got to be on it 3 to 4 weeks. But around that time, you really start to notice a reduction in anxiety, support with depression.
Just must be what happens in the brain with everything. I feel like absolutely every intervention needs like 2 to 4 weeks to work. The end. Like that is what I see all the time. It's like, takes about that long, then you can start to see a change. Like, must just take a little bit of a trickle effect where you can really see the differences for everything.
That's right. That's right. Unless you're prescribing a stimulant or a benzo.
True.
And then, so if you want to go down the pharmaceutical route, you can see your kid change in an hour after a stimulant. Not that I'm trying to villainize stimulants, but there's very little naturally if you really want to change like the underlying imbalance of the human. That's overnight. Your body needs time to hit that homeostatic mechanism and rebalance in a different way.
Right. Well, I feel like we could have talked for another hour about other topics. So maybe another time. Dr. Emily, where can people find you online?
So you can find me at neuronutrients.com and you can find me at neuronutritionassociates.com. And thank you for having me on again. I really hope, like my heart's desire is this helps even just one woman make the right decision for themselves. And I just enjoy our banter and our back and forth. And I think you're doing a really good job putting out important information.
Well, thank you. I feel actually really strongly on my heart to share these stories of success that can be such a ripple effect. I have several more kind of in the can related to this because there is some crazy things that happen to people and there's just not enough that's talked about. So how else are people supposed to learn about it? So thank you for coming on today.
Well, thank you for having me.
Sharing and reviewing this podcast is the best way to help us succeed with our mission to help integrate the best of East and West and empower you to raise the bar on your health story. Just go to reviewthispodcast.com/less stressed life. That's reviewthispodcast.com/less stressed life. And you'll be taken directly to a page where you can insert your review and hit post.